Hello everyone. I hope everybody is fine in health and spirit. Today I have come up with uh, another topic from development of heart and great vessels. Uh, let's share the screen. So in the very beginning, I'd like to share a beautiful graph done by one of our students before proceeding towards the topic. I hope everybody likes it. Now, what is the topic today? It is the fetal circulation. So, in the beginning, I'll be teaching you fetal circulation. Then, after that, I'll tell you what are the changes after birth. Okay. So, there are some models in the department which you have to uh, study and also deliver during the exam time. You'll be asked Viva with respect to those models, and it is equally important for theory as well. Okay, so this diagram is from Langman, and it almost symbolizes and it is almost as far with the model we have. So I'm using this diagram to explain the topic. Okay, so let's see what are the important factors. There are 6 factors that are necessary for fetal circulation in addition to the placenta. They are left umbilical vein, number 1. Number 2, the ductus venosus. Number 3, the valve of infravena cava. Then foramen ovale. Then ductus arteriosus. Then pair of umbilical arteries. So all these names are similar to you, I guess now, isn't it? We have almost finished everything. So all these 6 factors are very important for the fetal circulation. How these 6 factors play the role in fetal circulation, now I'll be explaining to you one by one. Okay. So you see this diagram here, the placenta is not drawn. You see that, imagine the placenta is here, and you can see the arrow here. The blood will be coming through the umbilical vein, and here is representing the liver with the infravena cava here, and this is the ductus venosus. First, I'll introduce the structures, then we'll go for the theory. Then the infravena cava is entering the right atrium from below. Above comes the superior vena cava, draining the blood from the head and neck and upper extremity. Okay, there is the foramen ovale here, which is the connection between the right atrium and left atrium. Then here you get a tricuspid valve, which will bring the blood from the right atrium to right ventricle. From the right ventricle, pulmonary artery, that is the pulmonary trunk here, which will divide into left and right pulmonary artery. But here another important structure, that is the ductus arteriosus, which is the connection between the pulmonary trunk and the arch of aorta. And this is the ascending aorta, which is the arch of aorta with the 3 important tributaries, branches, and then it flows as the descending aorta. You can see the lung here, one side only is drawn, where you can see the pulmonary vein coming to the left atrium. And this is the descending aorta, which goes down and divides into 2 common iliac and then the external iliac and internal iliac. And you can see the umbilical arteries, which will bring the deoxygenated blood back to the placenta. Now, how all these things happen one by one, I will explain to you. Okay. So before birth, the blood from the placenta, about 80% saturated with oxygen, returns to the fetus through umbilical vein. Okay. Now, on approaching the liver, most of the blood flows through the ductus venosus directly into the infravena cava, short-circuiting the liver. A smaller amount enters the liver sinusoids and mixes with the blood from the portal circulation. Here is the portal vein. Okay, I already explained how the portal vein develops. This, then what happens? Sphincter mechanism. Here I wrote with a yellow color because it is important. On approaching the liver, most of this blood flows through the ductus venosus directly into the infravena cava with the help of a sphincter mechanism in the ductus venosus. Okay, so this sphincter, what it does, it closes close to the entrance of the umbilical vein, regulates the flow of the umbilical blood through the liver sinusoids. It closes when a uterine contraction renders the venous return too high. And what it will do? It will prevent a sudden overloading of the heart. Okay. Then after a short course in the infravena cava, this oxygenated blood mixes with the deoxygenated blood coming from the lower limb. So this is the lower limb blood coming here, and this is the blood coming by the ductus venosus. So they will have a short passage through the infravena cava. Okay. Then what will happen in right atrium? Once it reaches, there will be a bulb in the infravena cava. Okay, I told you about that. So this infravena cava valve, it will guide the blood towards the foramen ovale. So you can see the red color with the arrow directly going towards the foramen ovale, and as it is red color, it indicates that it is mainly rich in oxygen. Okay, understood? So from the left atrium, it will go to the from the right atrium, it will go to the left atrium to the foramen ovale mostly. But a small amount will be prevented from the this amount of blood by the crista dividens. Now, what is crista dividens? It is nothing but septum secundum. It will prevent a small portion which mixes with the blood brought by the superior vena cava. Okay, so it will mix, it will come and it will mix up, and then this blood will go through the tricuspid valve to the right ventricle. Okay, it will go to the right ventricle. Now, what happens from the right ventricle? A little amount will enter the pulmonary circulation. Only a little amount will enter the pulmonary circulation. Since the coronary and the carotid arteries are the most and the first branches of the ascending aorta, the heart musculature and the brain are supplied well oxygenated blood. Okay. Desaturated blood from the superior vena cava flows by the way of the right ventricle into the pulmonary trunk. So you can see the arrow turning like this and entering into the pulmonary trunk. Okay. During the fetal life, resistance in the pulmonary vessels is very high. What happens? Most of this blood passes directly through the ductus arteriosus. Okay, you can see the arrow. So mostly it will go through the ductus arteriosus. Understood? I have colored pink color here, matching with the diagram. Now, from the ductus arteriosus, where will the blood go? It will go and enter into the descending aorta. You can see the descending aorta. But in the descending aorta, it will mix with the blood from the proximal aorta. Okay, it is coming now, it will mix with the proximal aorta. After coursing through the descending aorta, blood flows through the placenta by a way of two umbilical arteries. So nice, we can see the arrow here, black color. Then this descending aorta will divide into what? Common arteries. Then after that, these are the umbilical arteries. So through the two umbilical arteries, it enters the placenta. So did you get all the 6 factors now? So these umbilical arteries, if you can see here, this is much red. How much it was? 80%. Now, what is the percentage here of oxygen saturation? Is only 58%. Okay, so it is only 58%. Why it has reduced? Because you see by the this umbilical vein you get the saturated oxygen 80%, it is entering, then it is mixing with some blood here, then again it is mixing with blood here brought from the lower limb, then though it was going here some blood came and next to the superior vena cava, then it went and here again some more in the descending aorta from the proximal aorta. So by the time it comes to the umbilical arteries, it is only reduced to 58%. So this will go to placenta, it will get oxygenated. Okay. Now let's see what are the changes after birth. So once the baby is born, what will happen? There will be lot of changes because the baby will be delivered and the placenta will be delivered straight after the baby is born, and the umbilical cord will be cut, okay, and placenta will be disposed. So once that happens, there will be lot of changes and the lungs will start functioning, so there is no need of the placenta. So once the lungs start functioning, there will be lot of closure, and I'll be explaining one by one. Just see first what is the closure. That is the closure of the umbilical arteries. Okay, closure of the umbilical artery. So in this, what will happen? The distal part will form the medial umbilical ligament, and proximal part will remain a superior vesical artery. Now, how it happens? I'll tell you. Closure of the umbilical arteries. It is accompanied by the contraction of the spoon musculature in the wall, and probably caused by the thermal and mechanical stimuli and the change in oxygen tension. Functionally, these arteries close a few minutes after birth, although the actual obliteration of the lumen by fibrous proliferation may take 2 to 3 months actually. Okay, so distal part of the umbilical arteries form the medial umbilical ligaments, as I told you just now, and the proximal portion remain open as the superior vesical arteries. Now, what do you understand by vesicle? Vesicle means this artery will supply the superior surface of the bladder. It is an important blood supply of the bladder. Okay. Now, what is the next closure? This is the closure of the umbilical vein and ductus venosus, which follows after the umbilical artery. Okay. So this closure happens. The blood from the placenta may enter the newborn for some time after birth. After obliteration, the umbilical vein forms the ligamentum venous or teres hepatis, or you can say round ligament of liver. Okay, in the lower margin of the falciform ligament. Falciform ligament is an important ligament of liver. You'll understand in the abdomen class once you study the growth of liver. The ductus venosus, which courses from the ligamentum teres to the infravena cava, is also obliterated, and what it forms? It forms the ligamentum venosum. Okay. Ligamentum teres hepatis, you get it in the inferior border of liver, and ligamentum venosum, you get it in the posterior surface of the liver. Okay. Then comes the closure of ductus arteriosus. So this happens by the contraction of its muscular wall, and it occurs almost immediately after birth, and it is mediated by something important which is called bradykinin. Okay, some people call it bradykinin also, a substance released from the lungs during initial inflation. Complete anatomical obliteration by proliferation of the intima is thought to take 1 to 3 months. In the adult, the obliterated ductus arteriosus forms the ligamentum arteriosus. Okay. Then comes the closure of foramen ovary. It is caused by an increased pressure in the left atrium combined with the decrease in pressure on the right side. The first breath presses the septum primum against the septum secundum. During the first days of life, however, this closure is reversible. crying by the baby creates a shunt from the right to left, which accounts for cyanotic period in the newborn. The constant apposition gradually leads to fusion of the two septa in about 1 year. And what happens? About 20% of the population may have probe pattern foramen, okay, which I showed you in the previous classes. Okay. Now let's see what happens in the diagram. So whatever I have told you just now, you can see in the diagram. So here no placenta, no umbilical vein. What remains here is the ligamentum teres hepatis. Okay, this is the portal vein which we had seen in the previous diagram. So there is no ductus venosus. Okay, you can see the infravena cava which is bringing blood from the lower limb, and of course there will be the hepatic veins which will go here, and then the infravena cava coming and opening into the right atrium. From the above comes the superior vena cava draining the upper extremity and the head and neck region. And from here the blood will go to the right ventricle. The deoxygenated blood after this will enter the pulmonary trunk to go to both the lungs by the right pulmonary and left pulmonary artery. So here you see that there is no ductus arteriosus. What remains is the ligamentum arteriosum. Okay, ligamentum arteriosum. And as the lungs are functioning now, good blood, that is the oxygenated blood, will come here, and from the left atrium it will go to the left ventricle, and from the left ventricle it will enter the ascending aorta, then the arch of aorta. From the arch of aorta it will be taken to upper limb and head and neck region and drain through its branches. Then the descending aorta will start. Okay, then from the descending aorta a lot of arteries will take the blood to the important viscera and areas in the thorax as well as abdomen, and then the descending aorta will divide into two common iliac arteries. They will divide into external iliac arteries. They will supply the pelvic region and lower limb that I had taught you in the previous class. Now down below you are missing here is the two umbilical arteries. So the two umbilical arteries will degenerate, and what will be left is the medial umbilical ligament, as you can see in the diagram, and this area will remain as superior vesical artery. Okay, superior vesical artery. Okay, here. So here I'm showing you two models. They are from the department. Fetal circulation before birth and fetal circulation after birth. Actually, all the important areas are marked with 1, 2, 3, 4 like that, and here the names are there. You can see here. In the exam, we'll be covering all this and put it to you. You have to identify one structure. Like here, the light blue color is the portal vein, dark blue is the infravena cava, the green color is the intestine. Okay. Similarly, here what you can see is the all the regressed area are colored with green color. Umbilical vein is colored green. Then this ductus venosus will become ligamentum venosum. Here ductus arteriosus will become ligamentum arteriosum, and these are. So you have to identify, and accordingly whatever questions are asked you have to answer. Okay, this is another model which you can see. So you may get whatever as per the questions from the teacher you have to answer. Okay. Now I want to sum up my total development of heart and blood vessel class with a small video which is very interesting. Hope you enjoy it. Just wait for a second. So this brings to the end of my total classes from development of heart and great vessels. So all of you uh, enjoy this picture and think of some caption. Have a good day. Bye. See you all of you.